So tonight we are discussing adenomyosis. Say hi. Which one is this one? Right. All right. I think our flash goal is here. What are they looking for? Adenomyosis. Why is the name so big? Is it going to cost a lot of money? Well, we'll find out tonight. You know, when the name is big, they say pay, you pay, right? All right, we have 5 TikTok J. That's our flash goal. 5 TikTok J. All right. So, thank you, Lady G. I appreciate you. So, we're going to be looking at adenomyosis, and as usual, we will tell you the whole story in details. Don't worry. You don't. Even if you didn't go to school, you will understand it because everybody's supposed to know it. Yeah, everybody's supposed to know it. And this adenomyosis is what you consider the hidden uterine condition that many women must have been told that, oh, don't worry, it's just menstrual pain or it's just painful periods. I will disappoint you on that tonight. So I want to give us some time to invite people, especially those that are trying to conceive. You want to call them, tap on your screen, share the life. It's important, right? So let's help other people, not just for us. Just imagine one person that you invited, after 15 years, the person just became pregnant out of information, not because we give them drugs, right? The young said, Dr. Please, if a woman with 7 months pregnancy is this is fertility. It's a good question, but have you gone for ultrasound scan, the young? Have you gone for ultrasound scan? If you're just joining, if you're not following me, you want to follow me now. All right, while we wait for her answer, let's continue our gist. All right. So the right thing to do is to go for ultrasound scan. Yeah. Go for ultrasound scan. If it's viable, if there's a threat, we will know from the examination. Is that okay? So otherwise, don't worry. Sometimes you can have mucus or discharge coming out in that can make you fear. Is that okay? But until you give me the ultrasound scan, I cannot tell you anything. Right? Is that okay? So do that and let's see. Yeah. Thank you. Street character. Street character is here. Thank you very much. All right, so back to adenomyosis. You know, somebody somewhere is battling with this condition. Oh boy, I wish they would find us tonight. I would to God they will find us tonight. Thank you very much for the donuts. Thank you. All right. I would to God they will find us. Because many times they've been told, oh, don't worry, it's just your period that is painful. Really? You know, this has gone that way for many years. Where many women have been told that pain during your menses is normal. Earlier this month rather, we dealt with issues around that of painful periods. So if you were not here, I'm sorry you missed too much. But you're in luck. Go to my YouTube channel. Type it out. Painful periods or periods. The videos will come out so that you learn something. So I told you when what is supposed to be a normal period and what is supposed to be an abnormal period. And is painful period a normal thing? I've dealt with all that issue. So I want to deal with this condition, adenomyosis, right? When you've been told the pain during period is normal. Heavy bleeding. People, there are those who have heavy bleeding. And they are wondering, why is my own different? And still they still don't have answer up to today. Right? You hear things like, oh, maybe probably hormonal issues, all that, all that, all that, all that. But tonight, we will begin to demystify the condition. Yeah, it's not normal at all. We will demystify the situation. Why? Because while you are getting all that explanations, or people just waving it away with a wave of a hand, the cramps worsens. Yeah, the bleeding comes even heavier. Pelvic, your pelvis feels swollen or even tender. Pregnancy becomes even more difficult. Yet, somebody is telling you they be like that sometimes. Right? Something is happening to your uterus. Something is happening. And this is a condition that many people have never heard of, unfortunately. Everybody knows about fibroid. Oh, fibroid. Oh, fibroid. What about adenomyosis? Right? Adenomyosis is something a lot of people have not heard about. Right? And sometimes even misunderstood. When they get to know about it, they misunderstand it. And some medics even misdiagnose or underdiagnose it. Right? Some will dismiss it as ordinary menstrual pain. They don't know what's going on, but they just think that's menstrual pain, don't worry, you'll be fine. But tonight we're going to look at the details properly. Right? Even if you didn't go to school, you will understand today's gist. Right? Martha is here. Hello, Martha. Martha, I'm full of energy tonight because my testosterone levels high. My testosterone level is like this. So don't try me. So the reason why we're having this discussion tonight is because adenomyosis is not just bad cramps. It's the way they want you to see it. For some, they've never heard, so I'm going to enlighten you tonight, right? It's not just bad cramps. So, as usual, we'll start with the very, very basis of everything. Right? Let me reduce this sound. This is fertility. Okay, I think we're better like this. So let's start. Ebony class exercise. Is it true that a woman who is still menstruating at the age of 50 can still have? But if she's still menstruating, it means that there is the possibility of she ovulating. And if she is ovulating, which is the more important thing, yes, she can still be pregnant. So if you are 50 and you're still ovulating and you are still knacking, waiting no good, welcome. You will be pregnant pretty soon. You will. Right? But remember, everybody should knock. Everybody should knock. If you are not knocking, leave this live stream. It's not for knackless people. Right? We want the babies, so we need it to knock. All right, let's go back to the gist. So the first thing we should talk about. Let's answer the question. She said it's not me anyway. I know it's not you. Damilola, good evening. Good to see you. Right. So what is adenomyosis? Let's start from there. What is adenomyosis? Flourish said, if a woman has heavy flow without pain, is it normal? Okay, you need to go and check out my videos on menstrual periods. Is that okay? I've given all that details before. There are several things to consider. It's not just one thing. It may not be normal. Most of the time it's not normal. So go and check it out so that you can find the solution in that video. Is that okay? Yeah. So that's why I say don't miss my live stream, because if you do, you miss too much. You can find the videos on my YouTube channel, Dr. Godwin EMB. Just search it out, menstrual periods. It will come up. You know what a normal flow is and what an abnormal flow is. You know what a scanty flow is, what a heavy flow is. So much, so much. I tell you, if you are not on that YouTube channel, you are missing too much. Now, adenomyosis happens where you have endometrial tissue. And what is endometrial? A lot of people are coming for the first time. So if you're coming for the first time, follow me now. All right? Endometrial, inside your uterus, that area, that layer is called endometrium, right? It's called endometrial layer. Is that okay? Now, the type of tissue that is there is different from the other layers. Is that okay? I've dealt with that before. So now, when this endometrial tissue find themselves growing in the muscular part, which is the center, the middle layer of the uterus. When they find themselves growing there within the wall of the uterus, that is what adenomyosis is. But let's simplify it so that everybody can catch along. Is that okay? Because normally, right, what happens is the endometrial the endometrium, the inner lining of the uterine cavity, is actually functional. So every month it's built up, and if pregnancy does not occur, it sheds down as what you call menstrual periods, right? Menstrual bleeding, right? So in adenomyosis, those tissue that behaves like this, right, find themselves existing inside the muscular wall of the uterus. In other words, they are in the places in your uterus where they are not supposed to be. That is what we're talking about. So now, the muscle wall now is containing those tissues that behave like the endometrium. And how does the endometrium behave? It responds to hormone month by month in a cyclical way, right? Because of this, the presence of this tissue in the muscular layer, every other change that you observe, or rather in this condition, the problem starts with the dislodgement or the presence of those tissue, right? So now, remember when we were talking about the uterus, I told you all that there are 3 layers. The center layer is the thickest layer, right? That is the myometrium. And the uterus is designed for uterine function, right? the uterus is built for structure, right? To serve as a structure that will not only contain but hold together the formation of life. That is what the uterus stands for. So it's built for structure. It's also flexible. It's not just imagine something that is the size of a pear or a fist like this, that can grow as big as a large watermelon, right? It's that flexible and expansible. It also built for contraction. Remember again, even without pregnancy or anything, it is in a constant, gentle state of contractions like this. I've said that 1 million times already, right? So where there is, for example, during menstrual period, it is that same contraction that serves to clean out itself from the blood. That's why nothing beats the neatness of the uterus, right? From that gentle squeezing out of blood, it comes out and it's all clean, waiting for the next cycle. right? So if there is some kind of irritation, it squeezes harder. Sometimes you feel pain because of inflammation and all that. Or pregnancy, where when it's time for labor, there will be hard contractions, right? To push out that baby. You see, that is why those contractions are there. So it's either is in its docile state of gentle contractions, or is trying to squeeze out the baby. That is its natural function. So the uterine muscle is built for structure, for flexibility, and for contractions, right? It's not built for cyclical. I'm talking about uterine muscle, right? That the center one, not the inner endometrial lining. It's not built for bleeding to happen. It does not bleed. It is the inner wall that bleeds. The center wall does not bleed. So because it's not built for bleeding, when you now have endometrial tissues within it, scattered around, what do you have? That inflammation will increase. Inflammation will increase. It will swell, sometimes bigger than its normal size, right? And that normal function of the muscle will either be impaired or be confused, right? So this now will result to pain, heavy bleeding. Of course, the size of uterus will be big, and it will affect the whole dynamics of fertility altogether. If you are just joining, you're welcome. Please tap on your screen, share the live. And if you're trying to conceive, don't forget the preconception blueprint. Go and download it. Go to my bio. Tap on the link in my bio, right? Tap on it. You'll see the link there. Download it. And get ready in 3 to 6 months' time. Give us your testimony, right? Now, what happens during menstrual cycle is very simple. Or we'll just do the recap for those people who are just coming, because this is where biology becomes powerful. If you can understand it, do you know that each month, hormones, which we already know, hormones will stimulate these tissue that are inside your uterus to begin to develop, to begin to thicken, right? Now, the whole purpose is that the body is expecting to be pregnant every cycle. That's why the endometrial lining will grow. Now, if fertilization does not take place, if pregnancy does not occur, the feedback mechanism that tells the uterus to continue building, preparing for baby, will cease. So when they don't get that information anymore, all the structure of the inner lining will begin to crumble, and it will pour out as menstrual bleeding. Now, because these type of tissues are within the wall of the uterus, it will cause the uterus to thicken alongside, of course. Anything that happens with the inner wall will happen to it, right? So if you are menstruating, it is supposed to menstruate too, but there is no space for it to come out. So it's going to elicit inflammation and a lot of pain. That is the reason for the kind of pain that some people feel, right? That is the reason. Somebody, a more professional individual, actually asked, so why does adenomyosis cause severe pain? And that's what I'm trying to simplify. UK Diamond is here. Hello, UK. Good to see you. You're welcome. So why does this adenomyosis cause severe pain? Now we know that some tissues are finding themselves in a place where they are not supposed to be. So if you have that person, friend, sister, child that's in your house rolling all over the place when it's time for menstruation, that is not normal. So you go and find out, right? But study, listen to, watch my videos first. Go and watch the menstrual period video in the YouTube channel first. Then today's own. When you are done, bundle the person to the clinic for proper evaluation. Is that okay? Don't normalize it. Don't normalize it. And I've often asked, do you think that the person that created the body will create you to be feeling pain every month? Why would you want to think so? All right, so you need to see your doctor. Is that okay? So why does adenomyosis cause severe pain? Why? Oh, Kamin is here. So if you are writing, I want to list out the reason why adenomyosis is causing pain. If you are just joining, adenomyosis is a condition of the uterus, right? The condition of the uterus that will cause a lot of things that I'm talking about. Have you gone for evaluation? Have you done ultrasound scan? Have you been checked? Either you're doing ultrasound or MRI, regardless. So let me know. If otherwise, book a session. All right, go to see your doctor again. All right, the causes of severe pain. Why adenomyosis cause severe pain? Number one, inflammation. Inflammation. Why is this inflammation happening? Remember that there are tissues that are trapped inside the uterine muscles. The tissues that are trapped there are tissues that are supposed to be bleeding every month. But for some reason, they are now inside the wall, causing confusion. So those trapped tissues will cause localized inflammatory chemical to build up, right? They will increase prostaglandins. If you were here before, you know what I mean. These are hormones too. And it will cause swelling, right? All these put together will amplify menstrual cramping, to increase the intensity of menstrual cramping. And you begin to wonder, oh, why am I a woman? Now you know, right? Okay, Kevin, don't take us the other way. Just understand today on first. Then I will talk to you. Right? Is that okay? Do you understand what I'm saying? Who is understanding anything? Let me be sure. If you're understanding something, talk to me in the comment section. Just type understand. Let me be sure you're understanding something. After today, you'll begin to find solution to the problem. Right? You begin to find solution to the problem. So the first reason why adenomyosis causes severe pain is inflammation. The second reason is due to the DG says, sadly, that's what I'm battling with, but I don't have cramps. Because you are being managed now. Come on, man. Just don't worry. Just keep doing what you're doing. Of course, I know. Keep what you're already on track. So keep doing what you're doing. Is that okay? It can be managed. But calm down. Let me tell the bad news first before I tell the good news. Is that okay? You don't want me to tell the bad news. Calm down. So the second reason why adenomyosis will cause severe pain is abnormal uterine contractions. Right? Remember, the muscle wall was created for the purpose I mentioned earlier. It's always in a gentle, normal contractions and become serious whenever it needs to be serious, right? But because these tissues are in the wrong places, it's going to now disturb or disrupt that normal function of the muscle layer. Queen said, I have adenomyosis. 46. Still trying to conceive. Still trying to conceive. All right, you need to be managed, right? You need to be managed. I hope you're seeing your gynae and you're being managed, right? And there's some more things that I may need to tell you. But again, let's continue. So abnormal uterine contractions. So because those tissues are all in the wrong places, what do you have? The muscle becomes irritated. Yeah, becomes irritated, becomes disorganized and hyperactive. So please go to my profile picture. I have a video there already on adenomyosis. You'll be amazed. Just watch it. It's just less than 1 minute. You watch it. It's there. There's so much information there. Sumi Love is here. You are welcome. Good to see you. Right? So, because of that unfortunate presence of those tissues in the wrong places, what you have, the contractions become stronger than necessary. And of course, stronger contraction will mean pain, of course, right? It becomes stronger, more painful, and less coordinated. It's as if the whole world wants to come down just because something is going on in your uterus. Queen said it took a while to diagnose. Yes, because even medics can underdiagnose it. That's what I'm telling you. You came late. I mentioned it earlier. Right? Yeah. Is that okay? So even medics can miss it. Well, calm down. You are here now. You are here now. Get all the information you can grab so that by the time you go and see your medic again, your doctor again, you will be ready this time. Is that okay? You will be ready. So that's the second thing. What it does is it causes abnormal contractions and making the contraction stronger, more painful, and less coordinated. So there's confusion in that area. Confusion in Jerusalem. Now, the third reason why adenomyosis causes severe pain. Good evening. Who's that? Juice Luxury Hair is here. You're welcome. Good to see you. So the third reason is increased pressure. There is increased pressure inside the uterus. This beautiful uterus that we described a few days ago. Oh, it was so beautiful. Uterus is so beautiful. But now there's problem in Jerusalem. That's what we're talking about tonight. Is that okay? So this increased pressure, right? I tell you, the uterus may become, because of this confusion, the uterus may become enlarged. Yeah. Boggy and even tender. I wish I can show you what it looks like on ultrasound. I didn't get that picture, but don't worry. Don't worry. Just catch the one I'm giving you now. So this appearance will create pelvic heaviness. Why? Because if the uterus don't big past the way it's supposed to be, it's not going to be heavier than what it's going to be. Yeah, it is. So it's going to be causing you unnecessary pelvic heaviness, right? And you feel this deep aching pain. I know, I feel your pain. I've been in that business for many years now, so you cannot describe it more than what we know. By the next year, It's good to know, right? You may not be able to open, but it's good to know. You know why? The reason is because, in the last days, knowledge will fill everywhere. So for fertility, I'm the one that's going to give you the knowledge. All right. So these three reasons are the reasons why you have severe pain. Severe pain when there is adenomyosis because of inflammation, because of increased pressure, and because of abnormal uterine contractions. Is that okay? These are the three reasons. There are individuals, many of them, who have adenomyosis that are experiencing heavy periods. Heavy periods. Not just heavy period, heavy prolonged periods. And in most cases, there is a clot. They pass out clots. Remember when we were discussing blood clots during menstruation? I told you what a normal clot is and what an abnormal. But this category of people, their own are chairman. So why is it so? Why do they have this bleeding problem? The reason is not far-fetched. The reason is not far-fetched because you can have the endometrial environment already is abnormal. Hi, Casey Linda is here. Right? And even in muscle contraction, the efficiency of it is reduced. Yeah. Then what do you have? The regulation of blood vessels will change. And all this can eventually lead to iron deficiency, anemia, and chronic fatigue. Right? So if you have adenomyosis, I'm sure you can relate with one or two of the things I'm talking about. And don't just sit at home. Now, if you don't know whether you do have, but you are suspecting all the symptoms I'm mentioning, tomorrow, it's night here. Tomorrow morning, go and get evaluated. If you're already evaluated, good for you, right? But remember I was talking about fibroids the other day. What then is the difference? Thank you for the follow, Natasha. I'll follow you back ASAP. What then is the difference between adenomyosis and fibroid? Some people call it fine boy, right? So what then is the difference? Because people confuse the two. Even your ultrasound technician or sonographer or sonologist, yeah, especially the ones that are inexperienced, can sometimes diagnose the adenomyosis as fibroid, right? So what professionals are battling with is what I'm discussing as though we're in marketplace, right? Everybody should know. Everybody should know so that we want babies. We want babies. No, we're not going to hide any information, right? So a quick distinction between fibroid and I've talked about fibroid. So please go to my YouTube channel, Dr. Godwin EMB. You're right. Search for fibroid. You'll see there. And by the way, I think it's going to premiere. It's there. Something is premiering tonight, right? I'm in Abuja, right? There's always a video playing every night, 10 p.m. on my channel. So you want to go there, learn. Not for me. My own is to knack. I'm not a woman, right? So if you're a woman, learn this masterpiece of a body that God gave you. Go and learn it. Is that okay? Oh boy. Okay, where was I? I was talking about, okay, we're going to differentiate between fibroid and adenomyosis. Right? What is the difference? I've already done a good job with fibroid already, so I'm not going to buttress it anymore. Fibroid is just, they are actually discrete muscular growths. Yeah, discrete muscular growths, and they are defined lumps. When you see them on the uterus, you just know this is fibroid because they are discrete. They are well defined. So that is fibroid. But adenomyosis, right? When they are present, they occur two ways. You're not going to book today. When they are present, they occur two ways. There is the one that takes up all the muscles of your uterus. We call that diffuse or generalized adenomyosis because they are just everywhere. The whole uterus is like a sponge, causing confusion, right? So that one is generalized adenomyosis. Then there is the other one that is localized. There is the generalized and there is the localized. The localized one, who they cry here? What did happen? Adenomyosis don't show you shaggy. Yeah, sorry. Bele. Adenomyosis. Let me boo it for you. Don't worry, you'll be fine. You'll be managed. Don't worry. And when you are managed, nap waiting no good, bele go come. Is that okay? All right, please let's tap on our screen. We have stopped tapping. People don't vex for this adenomyosis, so they don't want to tap again. Even me too, I don't vex. Let's not talk about it again. So I told you, don't worry. If you have your gynae will manage you. Don't worry, I guarantee you. Especially if you are younger, right? So we have the generalized one, the one that take up all the uterine wall. Then there is the localized one. You just find them in the area within the uterus, right? And of course, on ultrasound scan, it can be discovered. Yeah, it can be discovered. So I just mentioned to you all the symptoms that you could feel. Now you can see also on ultrasound the way it appears. Is that okay? But the reason for having this discussion is how adenomyosis affects fertility. That's the whole purpose of this discussion in the first place. And if your question is, can adenomyosis affect fertility? The simplest and direct answer is yes. Sorry about that. Right? But calm down. Not everyone with adenomyosis becomes infertile. Is that not good news? Yay! Right? So, can adenomyosis affect fertility? Yes, it can. But remember, not everyone with adenomyosis becomes infertile. Right? Of course, I'm going to give you the full gist. So, how does adenomyosis affect fertility, or how adenomyosis may affect fertility? Who's ready for the gist? Talk to me in the comment section. Just type ready. Let me be sure you are there. As you are typing it, you are commenting so that the algorithm will know that something is happening. Is that okay? Let's do that sharp. Type and comment so that the algorithm help you correct. Right? Oh boy. I'm thinking about you. Solution has come. Now that you know, you will not be afraid. Humble Queen is here. So how adenomyosis may affect fertility? That's the gist. If you're just joining, you're welcome. If you're not following me, you follow me now. And if you're trying to conceive, you've gone everywhere, you've done everything, welcome home. Now go and download this my book, The Preconception Blueprint. It's a practical guide, step by step, blow by blow, on how to prepare your body, even your mind, for fertility. Go to my bio, tap on it. You see a link. Tap on that link, download that book. 3 months later, I will come to your DM, because of course, part of downloading means you're going to put your phone number there. I'll come to your DM. I want to see what you are doing with the book, because I'm not just giving it to you, right? I want you to do something with it. And if you're not doing anything with it, you give me my book back, right? But if you are doing something, and I think you need special interventions, we will advise you correctly. Be smart. But again, because it's free, people don't take it seriously. No, the book is not free anyway, but because the service is free, people don't think, oh, forget about it, I'll just go and take herbs, or go to Babalawo and get pikin. Good luck. When you tire, you come back, right? All right, where was I? So we're talking about how adenomyosis may affect fertility. So let's start with the first one. What does it do? The first thing is, it alters the implantation environment. Where implantation is supposed to occur, it alters it. Right? How does it do so? By causing the uterus to be inflamed. And this inflammation will affect the endometrial receptivity. One of the characteristics of your endometrial lining is its ability to receive embryo. If you have a uterus or endometrium that does not have that ability, you can fertilize egg for 1 million times. You will never be pregnant. Because endometrial receptivity is a key factor. Even with IVF, your doctor will always be interested in that part of the gist. Triple Kids is here. You're welcome. So, if the adenomyosis, alters the environment, make the whole place inflamed, receptivity of the endometrium is impaired, and attachment of the embryo will also become a problem. Because if none of this happen, forget about pregnancy. So that's the first thing. It will alter the environment, the implantation environment. The second thing that will happen is what we mentioned before. You begin to have abnormal uterine contractions, right? Because normally what the uterus do in that, remember I told you, the uterus is not just there. As you're looking at me now, the uterus is not just docile. No, it's in gentle, constant contractions, right? And now, this behavior helps it normally to support sperm transportation. Yes, it does. It does. It does. It also will help it to position the embryo after fertilization takes place. You see why uterine contraction must not be altered in any way? Because it helps to transport the sperm, and when fertilization takes place, the embryo as it's coming is helping it to position it. That's one of the many purpose of that contraction that is happening, right? So when there is disruption in that contraction, what do you have? If the contraction is interfered with, fertility will be impaired. Implantation timing becomes a problem. So that is what will happen. That is the second thing. That is the second way it can affect fertility, right? The third way is still about inflammation. And this inflammation will make it less favorable for implantation too. So if your endometrium is inflamed, implantation, forget about it. The environment becomes less favorable. So adenomyosis will increase inflammatory activities. That's what I'm trying to say. Right. Number 4 reasons, or number 4 ways it can affect your fertility. Remember what we said about the uterine structure, right? It will alter that structure. The uterus is not behaving like a home for a baby to grow anymore. It's because the structure is altered. Yeah. So pregnancy support will not be there any longer. Even the placenta development will have some serious problems. And anything that affects these kind of things will cause a lot of fertility challenge, right? If you're just joining, you're welcome. You're watching me at the FYP. And why are all of you gathering at that FYP, right? All right, go to the link in my bio. There are people who needs to talk to me one-on-one. So go still to that digital store. You see fertility consultation. Tap on it. You come to my DM straight. You can get my green app straight from there. Is that okay? You can. So let's begin to work with you. Is that okay? All right. I don't know whether it's here or somewhere else. Somebody asked the question. She said to me, can someone still conceive naturally with adenomyosis? I will let it soak until I see the taps before I answer that question. If you are not tapping, it means that you don't want other people to learn, and that is not fair. Do not gatekeep. Natasha, all right, good. Natasha, good night. We are not done. You are going. Natasha. I will look for you tomorrow. All right, good night. Make sure you are knocking with no good. Is that okay? That is the way to go. All right, let's continue. Question somebody asked. Can someone with adenomyosis still conceive naturally? Who's ready for that gist? Talk to me in the comment section. Just type ready. Is that Dija? Dija, are you here? Confirm you're here. So the answer to that question is yes. Someone with adenomyosis can still conceive naturally, because many people do, right? Adenomyosis is not an automatic automatic infertility, because the severity of adenomyosis varies from person to person, right? While some individuals will conceive naturally without difficulty, some other people will experience recurrent implantation issues and miscarriages. So yes, natural conception is possible, but depends on the severity. Is that okay? I hope that is clear. All right. So send your request. Come up, come and ask question before I go. Okay. Okay. Everybody have gone to sleep, so that I wanted to actually talk about how adenomyosis is managed. But since you have gone to bed, we'll leave it till further notice. The treatment approach actually depends heavily on age. Yeah, depends on age. Depends on, of course, your doctor must have known your history. So it also depends on your fertility goals, right? And how severe your symptoms are, right? That all your goal is here. So the treatment will depend on these three things. And the management would involve hormonal therapy, which I think one or two persons that I know already, is already going through this. And I keep on giving them all thumbs up. Keep going, keep going, keep going. We're almost there. Before this year ends, you will carry your baby, right? All right, where was that? So the management may involve hormonal therapy, may involve, of course, pain control, because depend on the severity, the symptoms. One of the symptoms is pain. Also, will depend on the fertility focus approach. Right. Remember, I said your fertility goal is key. So, what approach in this your fertility is being followed? So, it will depend on that, and there will be, for some reason, if it's more of a selected few would have to go through conservative surgery, right? Do you know that in severe cases of non-fertility cases, actually, you may just eventually suggest hysterectomy sometimes. More severe non-fertility cases, for example, if not for those who are, maybe they are not interested in having babies anymore, they may just say, okay, take it out so that you rest, right? How are you? I'm fine, Oyi. Thank you very much. Good to see you. Right? For some people, they may have to take out the uterus, right? So these are the issues. So the treatment will depend on the age, will depend on the fertility goal of the individual, and also will depend on the severity of the symptoms. And when the management is being done, it's going to involve hormonal therapy, pain control. They will now consider all this based on whether we are looking at fertility, depend on the fertility paths you are taking, right? And for some people, there will be some conservative surgery in some cases. Then ultimately, in very severe situations, hysterectomy may be considered. And I tell you, Oyibo people like that one well. When it comes to black man, they want to remove their uterus. anyway, long story short, I want you to understand. Adenomyosis is not just a painful period. That is a misconception, right? It is actually hormonal driven inflammatory remodeling of the uterine muscle itself, where you have endometrial tissues within the wall, muscular wall of the uterus. So you have uh, heavy bleeding, serious pain, and some people will have serious fertility challenge. But remember that adenomyosis vary seriously from person to person. Some are mild, some are severe. And what severe cases, uterus will have to be taken out. But depending on where you are or depending on your case, yeah, natural conception can still be possible if you are managed properly and correctly. So, as easy as that. All right. So pregnancy is possible. All you just need to do, see your doctor, get managed properly, knack waiting no good, and your bundle of joy is on the way. Right? But if you have some more serious concern, right? You need to see your doctor. You may need treatment or eventually ART, assisted reproductive technology, so that you stop wasting your time. Is that okay? So if you have a question, come up now. Otherwise, it's time for me to go.